What is a phonological disorder, and how is it diagnosed? Imagine trying to understand someone speaking but noticing they keep making the same speech mistakes. These patterns can tell us a lot about how their brain processes sounds. Today, we're exploring what a phonological disorder is and how professionals identify it. A phonological disorder is a type of speech sound issue where a person, often a child, struggles with understanding and organizing the sound system of their language. Instead of just mispronouncing individual sounds, they follow certain patterns that affect many words. For example, a child might leave off the last sound in words or replace harder sounds with easier ones. These errors aren't random but follow specific rules or patterns. Unlike articulation disorders, which involve the physical ability to produce sounds, phonological disorders are about how the brain understands and uses sound patterns. Think of it like a map of sounds that the child hasn't fully learned to navigate. They might consistently front sounds at the beginning of words or delete sounds at the end. These patterns can stick around longer than typical speech errors, especially if not addressed early. Diagnosing this disorder involves a detailed assessment by a speech-language pathologist. First, they gather a speech sample by talking with the child, asking them to name pictures or repeat words. This helps observe how the child produces sounds in different situations. Next, they look for consistent error patterns, like always replacing sounds made at the back of the mouth with front sounds. They compare these patterns to what is expected for the child's age, which is usually around 3 years old for being understood by strangers and 4 to 5 years old for most sounds to be correct. The speech-language pathologist also checks if the errors are stable or vary from time to time. Stable errors mean the child makes the same mistakes often, while variable errors show inconsistency. They consider the child's developmental history, family background, hearing status, and other factors that could influence speech. The goal of diagnosis is to understand if the child's errors follow specific patterns, which helps distinguish a phonological disorder from other speech issues like articulation problems. Once diagnosed, therapy focuses on teaching the child the rules of their language's sound system. This helps them understand that changing sounds can change word meanings and improves their overall clarity. Early diagnosis is important because untreated phonological disorders can make it hard for others to understand the child. Speech therapy helps them learn the patterns and rules of speech, making communication easier and more effective. Remember, professionals use careful observation and comparison to typical development to identify these issues accurately.